Hey everyone, I'm Indy, that's Karan, aka The Doctor. Welcome to this week's episode of the podcast. We're doing it a little bit earlier in the week on a Wednesday compared to a Saturday because me and Karan are filming together on this weekend in a COVID secure way that we'll elaborate on in a second. Karan, what's going on? Take me through things with you. I've got a couple of topics I want to touch on with you, such as the milestone passing of 100,000 deaths in the UK of COVID. I've got a couple of theories that I need to run past you. And a big talking point for later, but I'm not going to reveal it just yet. I want to keep you on your toes.
I see. It's been a good day today. Been looking forward to shooting the podcast. Like as you said, we're running a course this weekend for physician associate students. So looking forward to being in a teaching environment again, getting these guys ready for the exams. Today I had an interesting email from the Reverend.
Actually, no, it's Thursday. It's not Wednesday. My fault.
I know. I didn't want to correct you. I thought.
Thanks, man. I appreciate your honesty.
Yes, it is Thursday. And so, I got an email from the Reverend who works at all 4 hospitals in our trust. Mm-hmm. And essentially, I'd reached out because I wanted to start some wellbeing sessions for the NHS staff, the frontline staff. Having worked with a lot of doctors who are burnt out, that's the majority of my coaching clients, in addition to other professionals, such as dentists, lawyers, engineers. I know that we need to make mental health awareness, mindfulness, all this stuff more accessible for frontline staff. So the Reverend reached out to me today and he said, I love what you're trying to do. And he said, are you a spiritual person? Are you a religious person? Yes, I am a Sikh. And I said, but I want to create narratives which will appeal to secular people who are not religious, but still can feel and engage with the narrative.
This goes back to the topic we spoke about the other week about mindfulness and stuff, saying we're trying to make it, it's not, we're trying to make it more mainstream. This is clear evidence that it is becoming more mainstream to people that are atheist or agnostic. Is that the word?
Well, not even that. It's just, you might not identify even with those. You might not have a problem with God as such, or you might not be into your faith that you're born into as such, but it might not just be as appealing or engaging. I think the messages are very similar, but the narratives you create around them are slightly different. The Reverend is a devout Christian, but he was like, so we're going to get together next week to hash out how that's going to look and start running that. And then I had a great message from our very good friend Gobind.
Yes.
And I was just telling you about this before we jumped on the podcast, where he sent me a casting call. So we've been sending each other a few messages recently about...
This guy's moving into new worlds together. Now, flipping medicine isn't enough, coaching isn't enough, the world isn't enough, right? Now he wants to be an actor as well. Okay.
Well, look at DJ, man. Look at DJ, Dwayne Johnson, man. He's paved the way.
Oh, DJ. I thought you were on about just wedding DJs, but okay, thank you for elaborating.
No, that's me and The Rock,
You and The Rock are boys now, yeah? Okay.
That's it, DJ. So he sent me this casting thing, and it was really funny, actually. So... the casting company is called Desi Hamilton. Okay.
Yeah.
And when I quickly read it, I was at hospital. I read it. And I thought it read Desi Hamilton. So for everybody on the call, but it's not the Punjabi word for today. But Desi, I guess, is a word for like being brown, being Indian, being Punjabi. So this is a Desi thing. And so I was like, okay, it's going to be something like Punjabi or Sikh related, Indian related.
Hang on. So were you expecting to start busting out a rap and start singing straight up rapping, Alexander Hamilton, Sukhshinder Shinder style, like everything straight on, blitz, on point? No,
I just thought, okay, it's Desi Hamilton. I don't know what that means. There's a website. I'll check it out later. But it's going to be something where, they want me to be very typical. And then I got home. I tried to put that in the, Google. Nothing came up.
Put Desi Hamilton into Google.
Yes, mate.
What came up?
It wasn't Google. It wasn't Google. It was URL. I put the URL in for the website. And it didn't go anywhere. And I thought, scam company, Gopi, what have you sent me? The dead end thing. And then I read it again. I was like, it's Desi Hamilton. Right. So here's where it gets interesting. So then I go on their website and they have, they're a casting company who's found the cast for 4 Lions, Top Boy, a recent film I've seen on Sky, Jojo Rabbit. And I was like, wow, okay, this is the big leagues. And I put in my application, sent them my... my show reel, my content. And
do you still think you're being scammed?
Not at all. I'm just, like I said, very thankful to Gopi for thinking of me. They're looking to cast a doctor, so this could be it, man. This could be it.
This could be the big break for you to take us to new places, Karan. I could be the videographer you've always wanted on set Imagine that. Imagine how trippy that is. You being recorded on set and me recording you being recorded.
Inception.
Mind blown.
A dream within a dream within a dream.
And then one day I'm going to get my own videographer to record me recording you. See?
Wow.
It could go further and further, my friend. Never stops.
There's no end to this.
No end to it.
And then I've just had a PT session, probably about 2 hours ago. So we got a session in, feels good. I didn't have one on Tuesday because of primarily the ice. It was just too slippy. But yeah, feel good. And I'm here with you. How about you?
Tell me, have you had issues with your car driving in the snow? Because is yours a 4-wheel drive?
It is not a 4-wheel drive. I've been quite lucky. The only bad experience I had was there's a week between Christmas and New Year's. And where I live, at the bottom of the road, it goes quite steep downhill.
Yeah.
And I was foolish enough to go that way and not.
Okay, I'm going to bleep out the name of the road, but yeah.
Okay. So I was going down that road and I lost control of the car completely. I wasn't going particularly fast. And basically I was like, I'm going into the wall, I'm going to go into the wall. And basically what happened with the car is I didn't go into the wall, but I jutted out onto the main dual carriageway. Luckily, again, there was no cars coming. It was dead. It was like, like I said, just before Christmas and New Year's, lockdown anyway, but everyone was at home. And I was like, bloody hell, man. All that took was a car to come and, my car would
wipe you out.
So, yeah.
But I was thinking, near your road, there's like a massive hill. So,
that's it.
Wouldn't that be difficult to go up and down with the snow?
That's what I mean. So I've been avoiding that. So when I get to the end of I drive very slowly on my road, and then I take an alternate route, which is more mainstream.
Oh, I know the route. Yeah. Okay.
To navigate away from that, but
yeah.
I mean, I've been wearing wellies to work. Been getting a lot of compliments from my staff and patients. They're like, "Oh,
you get maximum wear out of all your items of clothing." I swear, you and your frugality is like another level. Like, for example, I can imagine you wearing your walking shoes on your walking boots on a normal walk, just to make use of it. You're definitely that guy.
Excellent observation.
I knew it.
Frugality is the cure, my friend. It's not.
It's not the cure, man. It's just like, Karan, come on, bro, live a little.
Yeah, but I'd rather have time and energy, brother, not physical things. That's the answer.
All right, okay, I get you.
Well, so it's whatever serves me, isn't it? So the most comfortable things I wear, that's it. That's all I need to wear. When I need to mac out, swag out for a wedding, different game, that's fine. Can get it done. But my most comfortable look is definitely when I go hiking. That's what I like to be in. That's what I'm wearing now on the podcast as well.
But they'll never know. So tell me about the COVID stuff. Like, what's going on? Because the milestone is 100,000 deaths. UK's become the first in, I think it's 5 countries across the world to surpass that. And obviously the government has said, now's not the time for it to be analysed and stuff. But I think surpassing such a milestone of that is a pretty fair time to do it. It's been pretty fucked up and difficult. And it just makes me think, why is that number so large? Is it because people aren't following social distancing? Is it because people don't believe in the vaccine? Is it because there's not enough support at hospitals? Like, I know it's not just a simple one-word answer, but is there anything from your point of view that you think could have been done differently or better to prevent any of this?
From a doctor's perspective, I don't think in that mindset at all. And the word I would have for you want one word? I'll give you the word. It's context. Context is the word. So the Spanish flu, 100 million dead. Okay. COVID, 100,000 sadly passed away.
Yeah, but
that's only the UK. I don't know the world.
That's in the UK though, right? The
Correct,
Spanish flu is
the
like over the entire time of it across the world. It's not really a fair comparison.
No, correct. But you can, I implore anybody listening to do a fact search on the total number of deaths worldwide because of COVID, attributed to COVID. It will not be 100 million. So yes, it is. But from a doctor's perspective, I don't look at what could have been done. And honestly, when I listened to the PM's address and then I heard the questions from the journalists, it really, really angers me.
Why?
When you've got these top journalists, right, asking the same question, all of them asking the same question. Boris, Mr. Johnson, don't you concede that things surely could have been done better? And it's like all of this looking back in hindsight where, look, I'm not envious of what Boris has to do. And even Prof. Chris Whitty said again and again and again, and it's been the same party line for the best months of the last 8-9 months, is look, we could fully locked down the country for the last year and a half completely, right? But it's balancing the health and the economy. And I've said this to a number of people privately. It's that, look, when people die of a condition, whether it be COVID or something else, because it's attributed to a health problem, generally, although people are sad, they can kind of accept it. But imagine we're in full lockdown, everybody's jobless, there's no income, there's no furlough, all that, all that kind of goes, and people are rioting and looting and dying because of that.
I get that, but
one sec. People will not accept deaths because of
I understand that, but there were some major fuck-ups by this government, like major fuck-ups. Like for example, the Dominic Cummings fiasco, where he was allowed to go to Barnard Castle, didn't lose his job, broke lockdown, did everything that you could basically do to take the piss out of it. Now hang on, this is important. When he did that, that implores the rest of the UK to think, well, if a top government advisor can do that, I can do whatever the fuck I want. And you notice from there onwards, that was lockdown 1, right? Coming out of lockdown 1. When lockdown 2 and 3 came into effect, people stopped giving a shit because they're like, no, the government does whatever the fuck they want. We can do what we want. If you don't lead by example, you set yourself up to be setting a bad example to the rest of the world. And you're going to have a lot of problems arise from that. That's only one side of it. The other side was the care homes fiasco, where they sent people back that had COVID to care homes, and it ran a fucking train through the entire care homes as well, and people living in there. And the care home death numbers were extremely high.
What's the alternative? Keep them in hospital?
The alternative was not to send them back when they clearly had COVID, which is what happened.
How do we have a functioning hospital if we can't discharge people?
Okay, you can discharge people, but maybe there should have been a better way to prepare the care homes for it and not just send them back and say deal with it.
Absolutely, my friend. But these are things, again, when you look at when you're on the ground, you're looking at the logistical aspects. You can minimize these things. Can you actually remove them or
of course completely? But there were no steps to minimize it whatsoever. There simply were not any steps to minimize it.
Again, we can agree to disagree, but my opinion regarding COVID is not to criticize anything. As a doctor, I deal with what comes through the front door. My goal is to instill confidence in people that, look, this will pass. And if you're sensible, this will pass. So being sensible, common sense, being as safe as you can. Being as safe as you can, not living in fear, is the only way we're going to move forward. Yes, you're absolutely right. When people set bad examples, other people do. And it's very hard without having a police state where literally there is, army on the streets. And if you step out your door, they're going to be like, what are you doing, kind of thing. Without that kind of level of military lockdown, then, it's very hard to enforce at every level. But yeah, like I said, I do not envy Boris's job.
I don't envy him either, but I think there were clearly some areas that he could have knuckled down on and been more difficult on. Even the travel restriction stuff, like closing down borders and making people isolate, that's massive, man.
Definitely more clarity on that. Yeah, I mean, the flying situation, that should have been right.
So
we're locking down UK, stop letting people in.
Yeah, so I've heard of people that have gone abroad, caught COVID, jumped on a plane, come back to England with COVID and just went home. No test and trace. No one on the plane was told about it, which means they probably spread it to everyone on the plane. Like little examples like that, and that's just one person, right? Imagine other people doing that on a mass scale because they were ill abroad and thinking, I don't have health insurance, let me go home to the NHS. Then we just try and sort this out one time. And there was simply no testing or anything like that set up.
There was a great diagram, I think, again, it came out early during lockdown 1, where it showed if one person gets it and, they don't isolate, the ripple effect of how many other people get affected because of that. Because it's been said during this whole pandemic, it's the invisible threat.
Yeah.
You can't see it. There are obviously asymptomatic carriers who are passing it on as well. And that's the most difficult. If you have no symptoms, but you're continuing to do what you do and doing, everything, but you can still pass it on to vulnerable people.
Yeah.
And then the other thing is the variability of the disease itself. You've got Prince Charles, who probably in his 80s, was okay, stayed at home, and look, he might have the best doctors, but the treatment at that point was exactly the same. And then you had obviously Boris Johnson, and he was taken to hospital, and I think he was on the verge of going to ITU. He's a much younger man, so the
he's exactly the healthiest, is he?
No, but just from an age perspective, it's quite scary. So yeah, 100,000 deaths, very, very sad. Hospitals are not letting up at the moment. It's busier than it ever was. But again, we go in every day, we deal with what comes through the door. That's it. That's all we can deal with it. We can only deal with what's in front of us.
Are you eligible to get the vaccine soon?
I've had the vaccine already.
What? You had it? Well, you didn't tell me this.
Probably never came up in conversation.
Should have hooked me up, man. What are you doing?
I had it. When did I have it? I think I had it the first day I was back after the Christmas, so 5th of January. I think I had it. And then I was okay that day. Then I woke up the next day, had a numb arm, and then I had a few chills. So much like when you have the flu, so I had body aches, headache, felt a bit feverish, and then by the second day, everything was back to normal.
Okay.
So not too bad.
When are you getting the second shot as well afterwards?
Yeah, so my one is going to be end of March.
What's the logic between the first and second shot? How come you can't just have one shot as if it's TB or something? Why do you have to have two?
So my understanding is when they've done the testing, the efficacy, so the protection it bears is a lot better when split over two. But Prof. Whitty, he did say on Monday in his briefing that actually most of the protection is actually coming from the first vaccine.
Right.
So this whole thing about, people saying, it should be 3 weeks apart like they did in the Pfizer when they did the trials, and saying, if we're making it 12 weeks, then surely by 12 weeks we've lost the antibodies and the immunity. His point was actually, no, what the studies have shown is that actually most of the protection is coming from vaccine number 1, and vaccine 2 is just more of a, let's say,
more of a booster, would you say?
Yeah, that's a good word to use. So that's the kind of the science behind the logic.
And why do you think some people have been anti-vaccine? Do you reckon it's because of the fake news stuff that everyone's seeing and whatnot?
Oh, I'll tell you a story, man. I had a patient come in, middle-aged lady, originally from Africa, and she'd come in with a cough and a bit of chest pain, referred from the GP. The GP was concerned that she might have a blood clot in her chest. There's something, I see very, very often. And I'm speaking to her, and she's in a congregation, she's a devout Christian, and she's part of the congregation. And her opinion or her concern about coming to hospital was she thought that doctors were getting patients in, injecting them with COVID.
What?
And then, and then letting them pass away. No. So this lady
like some kind of Frankenstein shit, like tape you down to a table, cut the head open.
I mean, she didn't give me the detail, but she's an Afro-Caribbean lady, and essentially she was saying, we've been told that they're trying to kill black people, so when they come into hospital, they inject them with COVID. And I said, oh my God. And then, a lot of my work was just reassuring her and speaking to her and just saying, dispelling all these rumors. And I was like, I've heard obviously about conspiracy theories, but this lady really, truly believed it, to the point she was scared to have the COVID swab when she was there, because she thought, we're going to put it all the way down her throat or something. And then she had it, and she's like, oh, wow, that wasn't that bad at all. And then she said to me, she goes, Jazz, I'm so happy you took the time to explain these things. I'm going to go back and tell my congregation that these things are all lies. And I was like, yes, please do.
When they say congregation, does she mean community or people back?
Yeah, like a church congregation here.
Oh, a church congregation here, right? I understand that.
Yeah. And
I wonder where she got that. I wonder where she got that from, though. Like, that's a pretty wild conspiracy.
No, somebody was telling me the other day. He was telling me there was something. Yeah, there was another one of my colleagues, registrars, telling me in America, I think in the 1970s and 80s, there was something really unethical that happened where they had a vaccine. I think it was for, I can't remember which condition. It wasn't a vaccine. They had a treatment for syphilis.
Was it for morning sickness?
No, syphilis. So syphilis is a sexually transmitted disease. Okay.
Yeah.
And what they did in a certain population is, so again, African people, black people, they essentially just didn't treat them. They kept giving them placebos because they wanted to see when syphilis progresses, you get more and more symptoms and signs, and they wanted to see what that looked like so they could study that population. So unethically, they were giving them things saying it's a treatment, but it wasn't the treatment. This came out afterwards. And so when my colleague told me this, I was like, no wonder the black population, is a bit concerned about what's been injected into them.
Yeah, of course.
So when I heard that, I was like, okay, maybe, this is how these conspiracy theories come along. But, people are talking about how, what's that film? Kingsman. The chip in Kingsman.
Yeah.
In the neck, yeah? Or like in Iron Man 3, people think they're going to be blowing up or something. Or
mate, people think that Bill Gates is going to be tracking everybody and all their movements because if they take the vaccination, he'll have these microbodies inside you and stuff, and he can just see everything you're doing.
Yeah, and then
I'm like, that's incredibly wild. Thank you. I appreciate the genuine imagination that went into that. That's smart.
Anybody who thinks that, next time you're on Facebook doing your timeline scrolling, when you see a sponsored ad, click on why am I seeing this ad? Different things you're being targeted on.
See how many touch points they have on you
already. Okay, and then tell me what they already know these things, man. And so
your phone basically is a tracking device, man. Have you ever looked at your phone and gone through the history of the tracking on Google, and it shows exactly you where you've been over the last 7 or 8 years? And I looked at it once and I was like, this is freaky. I don't even remember going to this place.
Yeah, I remember I was in Cancun actually, and it was a friend. We were on the spiritual retreat to 2018, 19, can't remember which year. And basically, he got my phone. He goes, "Jazz, let me show you something." Went through it, step. And he was there, and I was like, "Oh my god, that's exactly where I've been. And this is how long I spent there, and everything." I was like, "I didn't turn this on. I didn't even know the setting was there."
You did turn it on. You turned on location services. That's what you did.
So unknowingly, unconsciously,
GPS.
But again, it doesn't make a difference to me. But yeah, so lots of rumors. I'd say, look, get the vaccine.
Yeah.
That's my advice as a doctor. People are asking me, get the vaccine. There's a number of people who've had COVID already. So remember, look, the point of the vaccine is to get your body to produce antibodies. Okay, so in the event that you do contract COVID, your response to the infection is better, and so your symptoms are less. And ultimately, it's so that you don't need hospitalization. That's the key. Yeah.
Okay, and in terms of the whole response to COVID, like just the pandemic, were you ever taught this in medical school? Like when a pandemic strikes, it will look like this. Because I was talking to my sister-in-law today. Shout out to her for listening to the podcast and really enjoying it. She gave us some good feedback as well, saying that she really liked our dynamic and stuff, and she likes your medical POV. Hence why I'm pushing you on this a bit more today. I think her question was, are you ever shown that this is what a pandemic will look like and how it will strike in med school? Because her husband has a background in pharmacy, and he's basically said he's predicted all of this step by step. Like, there's going to be another strain, there's going to be a lockdown, there's going to be deaths, etc. Like, he pretty much predicted it step by step. And she was thinking, is that ever told to you guys in medical school?
Okay, the simple answer is no. But what I would say is, obviously, within a hospital structure, although I'm on the shop floor, as it were, the managerial levels above me have what we call disaster planning. So it's the same if you think about, like, okay, when 7/7 happened in London, terrorist attacks. Okay, so major incident, the emergency services obviously deployed. They are trained for situations like that. Not exactly like that, but when major things happen, or the stabbings that happened in London, or I guess it could happen if there was like a natural disaster. That's the other type of big situation. Then yes, there is disaster planning and protocols and algorithms that they run in terms of how to deploy services. From my point of view, then what happens is, like, if you go back to April, when we kind of had this kind of initiative that, okay, we need to empty hospitals because we need to get ready for people coming in with COVID. That's what we were doing. So then we were having lots of local meetings. So it all gets distilled from the top. So the emergency rotas are created. Everything is pushed back. So non-emergency services, elective, like let's say a knee operation or hip replacement, they'll get cancelled, and everybody gets, well, most people get redeployed so they can manage. The two things to really manage are people who confirmed COVID who are on ITU, who need, you need a lot of manpower with the turns and the ventilation and their personal care. So that's one lot of manpower you need. And then the other lot is you need what we call the front door management. So it's everything coming in from A&E. Because like I said before, it's not just COVID coming in. So this week, I've had had a lady who's got spontaneous swelling on her leg. I had a lady who couldn't breathe, not COVID related. I had a lady who just kept bleeding. She kept vomiting blood. And, that was really difficult to manage. Took most of my day. These are all non-COVID related things. So that's really where the workforce is going. So it's deal with the COVID and help with COVID in ITU sense, and manage everything coming through the front door.
Okay, so there's no set structure, but there are people above sort of potentially planning it out and thinking for the future.
Yeah, and they distill it to us, and then we're the pawns. We move into that, and just execute basically on those plans.
Can you go on a COVID ward with your beard?
Can I?
Can you be on a ward, or do you have to wear like a certain? Is there a certain face shield? Because I remember when the first lockdown happened, there was a post that went around of a couple of Singhs in Canada who shaved their beard off completely because they really wanted to help, and they'd never done that before, and it was like a massive simplistic thing where they were saying from a Sikh point of view, or Sikh point of view, you shouldn't trim your beard, you shouldn't cut your hair. But obviously, Sikhs are taught that they need to be doing selfless service, and that's clearly a selfless act to do in order to help people on the wards. So, I was thinking, has that been addressed yet for guys like yourself and me, really?
Yeah, so there's a couple of masks, obviously, people will wear in hospital. You've got your standard surgical mask, which most people have access to. Then you have your FP3 mask. So that's the point of that mask is they get people to shave so that there's essentially no gapping between that mask and the skin. So you have what we call a face to fit test.
Right.
So what they basically do is they put the mask on, they test to make sure there's no breaks in that seal. Obviously, hair is a problem, and then you've got the full it looks a bit like a hazmat suit. It's a breathing ventilator thing which you put on and you use. Now myself, because I don't work in ITU, I'm not required to wear that full. That's what I'd have to wear because the other mask obviously doesn't fit. So in my area, if there's somebody who is COVID exposed or potentially COVID, then I wear a surgical mask and then I have a face visor which comes on top. And that's my general approach when I'm around potentially COVID patients.
And that's okay. Yeah, that's acceptable.
Well, it is what it is, man. I mean, this is advancement. Like in April, we didn't know what PPE to wear. Like everyone was just kind of making up their own PPE.
Yeah.
A was the stock, so we didn't have everything, and B, it was just everyone doing different combinations of things. But ultimately, everyone I worked with back then got COVID. At some point.
Wow.
So, yeah, it's one of those. I mean, just today, actually, I haven't met this chap, but there was a consultant who used to work in my department, but before I joined the hospital, who sadly has passed away from COVID. He was on ITU, ventilated, sadly he's passed away. So, yeah, it affects everybody, doctors alike.
And is there anybody potentially in hospital that may have ducked it, for the whole year? That's been like, I've just missed it, I've not caught it, or I've not had it? Or is it pretty much run through everyone and you've just built up herd immunity, would you say?
I've got one colleague actually, Jenny, she's one of the registrars, about to be a consultant. And we always have this laughing, running joke, which is she's just not got it. And, even if I have like a little cough, like a tickly cough, she's like, Jazz, you just back up, man. You back up, stay
germaphobe.
She'll just look at me and be like, you get tested again. So running joke. So yeah. Virtually everybody I know has had it at some point. But yeah, it's okay.
Damn. Well, now we've marked that event, I think we can maybe touch on to happier things. So let's talk about religion and caste. That's a really happy topic. I'm kidding, it's not. But I'm hoping we can try and make it a bit more lighthearted. So this has been one that I've wanted to learn more about because I don't really understand it. Again, it goes with, as you said, learned behaviour and preconceptions that you're taught growing up. But break it down to people. So what's the difference between caste, culture and religion? I think it's those three sort of get clumped together. Yeah. So, for example, I'm trying to tell people at work, I've married a girl, or I'm marrying a girl, Sanj, who is the same caste as me. Because, sorry Sanj, I didn't mean to speak badly, please don't beat me up. I knew that I had to work within the parameters of finding somebody that is the same caste as me, right? The caste of me is a farmer, aka a Jat. That's what it's called in Punjabi. So Jat means farmer.
Punjabi word for the day.
That's the
from
word for the
indie
day.
man.
Farmer.
Say it again.
Jat.
Okay, but here's the real question. Are you a proper Jat?
I'm not a proper Jat, no. So basically, there's this running joke in Punjabi people where we all glorify the caste thing and we take the piss out of it. We don't really mean it.
Some really do.
Yeah, this has been said to me. It's been said to me by my own family saying, "You say you're Jat, etc." And I say, "Yeah, I say it as a joke and I actually mean it." But the fact that you think I mean it is worrying. I won't play up to it or say anything in that way.
Okay.
And people just play up to it. And the proper Jat thing is like there was a video around of a drunken old man running around saying, "I'm a proper Jat" to people on the street, even though he's smashed out of his face at 9:00 in the morning on the street. So yeah. Now, caste itself, people don't understand that there's Sikhism as religion, there's culture, which is Punjabi. And there's caste, which is occupation. Would you say?
Yeah,
occupation.
Yeah.
Those three all get mixed together. So I'm told that I have to marry somebody who is religion Sikh, caste Jat, farmer, and culture Punjabi. So I'm told I have to match these three criteria. Right. Thankfully I have, but I know that Shindi isn't a Jat. I know that you are, but Shindi isn't. Yeah. Was that an obstacle for you, would you say? And is that something that has been a difficult issue for people in your family to get their head around? Because I know if I did that, all hell would break loose in my house.
Okay. So to answer the first part of your question, so initially, I think when I got with Shindi, I think I was aware that she wasn't Jat, but that was the first thing. It's not like I was going around looking for.
You know what's mad? Yeah, that's one of the first things that we used to ask each other at uni.
Yeah, are you like Jat? Yeah.
I didn't used to say, "Are you like Jat?" Right?
So what's your surname? And then you're googling her surname.
Are you like Jat? I don't say that to her. I don't say that.
No, you like. So what's your surname? Yeah, what's your surname? Yeah.
Yeah, but some of the surnames are really conspicuous. Like some of them go like into numerous different castes, and you're like, well, okay, you can't really distinguish now, can you, without saying what's your caste, right? Even though you shouldn't ask that question, considering it's such a far removed thing from us now, we still ask it because you want to obey by your parents.
Exactly. So the intention is not that you don't want to like somebody because they're not the caste. It's more if this is long term. You're looking at somebody as a long term partner, then you don't want heartbreak down the road. And that's
so you want to know early on straight away.
Yeah. You need to fact check, man. You need to get in the surname checker. Checker. I don't even know this exists, but again, somebody listening to this, please go on Google, post us a comment afterwards. See if there's a Jat surname checker that exists.
I swear there is, because when you type in surnames of people, you can see all their like different castes on Wikipedia and stuff.
Oh, there you go.
I know it's editable, but still. Going back to you and Shindi,
Yeah. So I think at some point she told me she's not Jat, so she's Tarkhan, which is carpenter, and I was like, that's cool because like I like you. It doesn't really matter to me. And
wow, what's that like?
Yeah. I would say the family I live with, it wasn't any real major issues. Like my dad was like, "Oh, okay." Like, are you sure? It was more like one of those.
Oh, that's all right. I can cope with that. Are you sure? I'm like, yeah, I'm sure.
Yeah, he's like, how long you been together with this girl? I'm like, are you sure this is the one type thing? Mom was pretty cool about it, and all my family in India. My family in India. Here's the interesting takes. You'd think that they'd be like, "Pakke." Pakke means Punjabi word for today. It means certain, like proper. Like they're going to be like caste. They were like, look, in India. Anybody just marries anyone. Like you've got Sikh people marrying Hindu people, you've got Hindu Punjabis, like there's just so much there, and they really, really don't care. One second, the circles eye rolling, right? And then so this is my master speaking. You might know the wording. You remember master?
What's a master?
Master is Masi's husband.
What's a Masi?
You asking me for you or for the listeners?
No, I'm trying to clarify for listeners, right?
Oh, okay, that's fine. I was a bit concerned if you did. So Masi is your mum's sister, real sister.
Okay, fine.
So your master is your mum's sister's husband.
Okay.
So you remember him, Indy? He was at the wedding. I gave him a special gift on the black tie event. Qatar bought that bottle for him. It was actually his birthday on that day.
I don't remember, but
27. Okay. Well, anyway, he was like, "You guys in England are so obsessed with caste." This is what he said to us. He goes,
"Really?
Yeah, in India." He's like, "We do not care in India, but you guys make such a big thing in England. He's so backward." That's what he keeps saying. It was so funny to hear it. Yeah. He was like, "Why are you guys still obsessing about this kind of thing?" And so my Nanaji, they're kind of like heads of the family from that perspective, grandparent level, and they were like, "It's cool. You got the blessing." Because the key thing that came down to it was, and this is the point I'll touch on later, is what is the family like? What is the girl like? What are her card like? What are her values like? That was the key.
Sankarmi's values.
Correct.
Man, people are getting some proper Punjabi lessons today, man. How many have we been through already?
Sanskar. Sorry, the word is sanskar. That's the word.
Sanskar, okay.
Sanskar means values. What are her values? What are her family's values? What's her social etiquette? How does she carry herself? How does she speak? And again, that extends to the...
See, now that's a stumbling block normally, because instead of even getting down that topic, I'd be told, no, I can't marry somebody outside of being a Jat because they do things differently to us. And I'm like, define what you mean by do things differently to us, because Absolutely. I've met some pretty bad people that are our caste that aren't great, and I've equally met some fantastic people that are of a different caste that are some of my closest friends. So I'm like, Absolutely. Well, that doesn't make any sense then. Like, clearly your notion or thought that everybody is going to be in this definitive box of values and there's nothing else outside of that, they're in that stereotype, you cannot break out of it. It doesn't make sense. It's stupid.
I'll give you an analogy. The reason why, from a parenting, let's look at parent level or grandparent level, whoever is doing matchmaking based on caste, why do they use it? Because they're using an approximation. They're using caste as a surrogate marker. So, for example, if I really, really wanted to look at how well you are indeed in terms of your actual body's health, right, I would need to look inside your arteries to see if there's any plaques and any clogging. But I can't do that. I could do that, but it's quite an invasive procedure, right? So what I do is, to get a sort of surrogate marker for your health, we might just look at the way you look or measure your body fat or just that kind of thing. So it's a surrogate marker. It's not the best marker, because I've told you what the best is, but I don't want to do it. And in the same way, when matchmakers are asking about caste, as you said, they are making presumptions. They are generalizing that this caste equals these sets of values. And it's the values which they're actually important. In the same way, now we haven't touched on this, so your thing was also, you said culture, caste, religion, but sometimes it's also occupation, degree. What degree have they done? What level of education have they got? And again, it's not about the education, it's about the approximation of, oh, he's a doctor or a dentist, therefore he must have these values, I'm assuming that. Really what you should be doing is judging the person on their merits. What values does this person have based on the life experience they have, irrespective, and not trying to put them in this, generic box. Yeah. That's why the caste system, I think, exists now, more to approximate.
See, I think it exists because of that, but also because our parents, well, my parents, maybe not yours, are living and still have in their head that India is like this time frame from when they were married. So when they were married, they were told, you must do this, 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 and this. So it must be this rigid value, this rigid set of characteristics. They must be Jat, they must be Sikh, they must be Punjabi. You can marry them only. They brought that over to England, and they've put themselves up from India and plonked themselves into England. But then India moved forward and changed a little bit.
Correct.
And they've broadened, and the guys here in England have just stayed. They haven't moved forward, right? Yes. They should have moved forward with it, and then naturally it would have died out, but it hasn't. Instead, it's become more staunch and more and more digging their heels in.
Yeah, absolutely. If you look from a Sikh perspective, then, Guru Gobind Singh Ji Maharaj, our 10th Guru, 1699, when the Khalsa was formed, when he bestowed the name Singh and Kaur, the whole point was to say, my Sikh is my Sikh, my Sikh is my Sikh. There was no differentiation. And if you look at the Panj Pyare, they were each of a different caste, right? Making the point that everybody is equal in the eyes of the Guru, everyone's equal in the eyes of God. And that's what we should be teaching going forward. Not the sense of... And again, you think about music. Music personifies and glorifies being Jat. So it's not
Of course
surprising
it does.
that
Of course
youth
it
come
does.
up.
It also clarifies and it also personifies
Glorifies.
and glorifies alcohol. It's a massive thing. Like alcohol is a massive thing in Punjabi culture. Like I know.
Sharabi, menu hor na pala, nahi mein ho gaya sharabi.
What does that mean?
I am drunk. Ho gaya sharabi. Menu hor na pala. Don't let me drink anymore. Right? Or aj main peeni pad ke glass. I'm going to drink today. Fill up my cup. It's the worst lyrics in the world.
Yeah, of course it is. When you translate to English, it makes no sense. But it's a banger when it comes on at a wedding. You're like, yes, give me this orange juice, man. Let's go, right? But there is an issue where I think there is a stereotype where people think Sikh weddings are the most live weddings ever because they're really extravagant and out there, and free alcohol, free bar, free food, 3 days of partying. But then I'm like, not really. The Sikh part of it is the marriage part in the morning that happens. The Anand Kaddish. That's the Sikh part. Everything else around it is culture.
It's Punjabi.
Right? None of that is Sikhi. That is all culture. I need people to understand that is all culture. Right?
The differentiation is so important to the point where, Indy, you know me, I don't drink, and I remember when I was a first year doctor, I was on a consultant ward round, and I think my consultant was asking me, Jazz, are you going to get married? And I was like, yeah. And then he was like, oh.
To Shindy, yeah. He knew that in first year.
He was
I'm bigging you up. Take the bait. Shindy, I promise. It's okay.
He's like, yeah, you Sikhs are big drinkers. That's the statement he said. Right? And then I was like, this is the problem. I was like, no, sir. I was like, a lot of Sikhs happen to be Punjabi, and Punjabis are big drinkers, but there is a big distinction, right?
Yeah.
Although, you can be Sikh and Punjabi, and that's where the confusion comes from. And, I just took the time to explain it to him, and he was like, oh, I didn't realise the difference. And like you said, open bar is what Punjabi weddings are known for. Live parties, dancing, just people getting wild. We can't wait for your wedding now.
Yeah, my 15 people wedding. Let's go.
Civilized sit down wedding.
Civilized sit down. That's it, man. Keep it nice and small and tight. But it's just the stereotype and thought of it. When I tell people that a normal wedding would be about 500 or 600 people, they look at me in shock, like, what? I'm like, yeah. The costing of it becomes quite astronomical and ludicrous, and people put themselves in debt for it, man. And that breaks my heart. I'm like, shit, live within your means. You don't have to have this big massive party, even though it's something that your parents might want, and even if they're happy to bankroll it, I'd rather them keep the money and just have it for their own sake, or put it towards something like a house.
I was gonna say I'd say that's becoming the trend now. I have a few friends who forgoed a reception and use that money for a deposit.
Yeah.
So it's it's one day versus the rest of your life. Yeah. And again, when it was 2019, I was in Italy. We had family holiday. At the end of it, we attended a close family friend's wedding. So they got married in a place called Bracciano, which is about an hour north of Rome. It's actually the castle where Tom Cruise actually got married. So it's a really famous place. And anybody who watches the program Medici on Netflix, you'll see the castle in there. And, at this reception, literally 80 people. And, afterwards, still Punjabi, we still have Punjabi food and we got a dance on and everything. But it's very intimate. And I think this is the way weddings are going to go forward now. People want to spend time and enjoy with people. I always say the people, if it's your wedding, the people that are there at the end on the dance floor with you are the people you want. The people that
they're the ones you want, because the ones who stay to the end are the ones you genuinely want there.
Yeah, the real ones, man. I remember at my reception, the black tie event, is the last event of the week. I was absolutely shattered. And
you asked for it,
mate. Until 1-2 a.m. and you guys were all there on the dance floor. That's it. That's all I want. I mean, the family is there. You guys are there. Those are the memories I'm going to take with me. And when I look back at the videos, that's what I remember.
This isn't to berate anyone that's having like a big wedding either. Like, if you want to do that and that's your thing, by all means have it, man. I wanted to initially.
Intention.
Yeah, I wanted to initially, but then now I'm thinking back on it, maybe it's smarter to not, and I'm actually quite content with just having a smaller wedding so I can move forward with my life a little bit. Instead of having to try and
move forward with your life.
As in move in with Sanj, move into a different part of the UK, move to London, like all these things that stop me from doing that. The only thing that stops me doing that is getting married. So I'm like, well, let me get married so I can open the door to all of those things, right?
Yeah, that was in the first podcast, wasn't it? The means
to it's not the means to an end, right? It's
the means to cohabit. Yeah,
it's the means to cohabit. Yeah, definitely that. Going back on the casting, when I told Mum about Sanj, this is hilarious.
Go on.
I tricked her into it. So I said, Mum, I found a girl. She's like, oh, okay, what's her name? I said, Sanj. She said, okay, cool. I said, Mum, there's a slight problem though. She's to the Khan. She's like, it can't happen. I was like, why can't it happen, Mum? And she said, it's not right. They
pause. It's not right.
Yeah, it's not right. They do things differently to us. I can't allow it. I won't agree to it. I'm like, but Mum, she said, yeah. I said, a couple of years ago, you went to one of your friend's weddings, who's I think it was her friend's son's wedding, who was divorced and remarried to a person who's white, who has now been baptized to be Sikh. So she's converted to Sikhi. And I'm like, you went to that wedding, and by you going to it, that means that you've endorsed it and you accept that. So you accept them marrying somebody who was white and now they've changed into this. But I'm marrying somebody that is Sikh already, and they could be a different caste, but you won't accept it. She said, no. And eventually, I just went around in a circle saying, but you practice Sikhi, Mum, and you sit there and you do your prayers and stuff in the morning and whatnot. And it even says that you shouldn't believe in caste, but you do. I don't understand this. It doesn't make sense. And eventually she got to a point where she said, okay, fine. All she said was, okay, fine. She shouldn't say I agree. I said, progress. That's it. Okay, fine. She said, yeah. I said, Mum, that's great, because she's Jat anyway. And then she tried to slap me, and I just pissed myself laughing. But I'm glad I broke her out of that mold. I'm glad I broke her out of that mold to make her see how ludicrous she was being. And that to me was progress and a big step in the right direction. I know I could never do that with Dad. He probably wouldn't talk to me for a week. But I'm glad at least I did it to Mum, because she's more open-minded about things like that. But the culture...
I like your line of questioning there. It's exactly, you get angry about these things, and I know a lot of friends...
Oh, don't get me wrong. I had to be in the right frame of mind to have this conversation, because I would have got angry. I think it was on a day where I was feeling pretty good about myself. And I was like, let me just put this out there now, you know?
No, it's important, and if you are going to challenge your parents on, we're the next generation, and we're going to have kids, and they may come to us, I mean, okay, marrying out of caste, one thing. Imagine, Indy, our kids come to us and they're like, well, I want to marry somebody who's not Sikh. I often get asked, like, oh, Jazz, what would your response be, if your child wanted to do this? And I was like, no, we can sit here all day and do these hypotheticals, but again, it will depend on the person.
Yeah.
And again, if you are going to have that conversation, so this is us speaking to our parents, then it's really to understand their intention. So is it that you don't like the person, or is it that you're assuming, it's that they have these traits based on this caste? Are you generalizing, or there's a real reason which is not really the caste, and it's just that you don't like the person? And using kind of logic-based arguing, essentially, or reasoning, you'll flush out what the actual thing is. Sometimes there's nothing, and then that's when you're like, okay, so your argument has no basis. You're conforming. That's what it comes back to.
Yeah.
You were told this from the generation above, so now you're telling me not to do it, but you don't really know why. You conform, so you want me to conform.
Do you think part of it is also just down to fear of the unknown and not wanting to take that step?
There's unknown, but again, I don't know what that means, because it's like, what this person, if the person's going to live with you in the house, are they going to start doing like weird ceremonies that you don't know, or is it what are other people
but with the same religion?
Community.
I'm like, hang on. Huh?
Community. What are people in the community going to say? They're going to say all these things, and it's like, because that.
By the way, translating that means this guy married that woman. Oh dear.
Right? Oh dear. Right? People gossiping, basically, and it's okay, how often are you going to see these people? I had this conversation with a friend, right, and he basically said, right, so you're concerned that some members in our family are going to have to interact with this person, right? And then he calculated, he said, so probably about 15 times a year is how often we're going to meet, and that's your concern. And then again, when he used it in that kind of way, in that reason logic, they were like, oh, okay, yeah, it's not that big of a problem.
It's not the most logical grounding.
You see what I mean? But you have to approach it like, because if you come from a place of anger, then you get nowhere, and it's not good for either party then.
Wow. And that goes back to making other people happy instead of making yourself happy as well.
Conformity, mate.
So say if your family said no, you can't marry Shindy, then what would you have done? Would you have conformed or would you have gone against it?
Hard to say because it worked out. I would have done what you did basically. So used a line of questioning, reasoning, and sort of just being persistent with it. And eventually, for parents, what is it? It's either you're going to lose a son or a daughter because of this, or you embrace the change and you have them in your life. I mean, it really, really comes down to that. I do have a friend where his parents basically said, "Okay, bye bye," didn't come to his wedding.
Okay, bye bye.
Yeah, didn't come to his wedding, and then I think, when he had a child, then they kind of eased up, and now they're all happy families. But so there are going to be some people who are going to be quite standoffish. And my advice is really get to the root of the problem. Do they have a problem with the person? Or is it they're just hiding behind this label of caste or religion or this level of education, or their parents don't have this level of education? Like, what is the real thing? And then as the person, as you in the relationship, what's important to you? So for some people, it is important that their in-laws are a certain way of carrying themselves or thinking or perspective, because you will have to spend time with your in-laws as well. And I know for a lot of people, or you do the opposite and you're just like, well, I'm not going to spend time with them because I don't think this, but I like the girl or I like the boy. But I don't think that's healthy either. I think there needs to be a balance. So yeah, a lot of things. When you go into a relationship, you need to consider all these things. That's my advice.
Yeah, it's true, because I know a lot of the parents say you should marry somebody for the family. The family's good, so therefore the girl will be good. And I'm like, not necessarily.
That's an old term, isn't it?
That's a really old term. They have a nice family, and I'm like, Mum, I don't care about the family. What's the girl like? Like, I'm marrying her. I'm going to be moving in with her. Like, tell me what that's
again,
about.
What they're saying, and again, they don't. It's just it doesn't get articulated right. The apple doesn't fall far from the tree. That's what they're really saying. They're saying if the parents are like this, then the daughter or the son is going to be like this.
Okay,
right?
but using that same logic,
right.
If that person has an alcoholic dad, does that mean all the family drinks alcohol all the time, but the kids are going to be alcoholics as well?
Absolutely not. So the point is not to generalize, but the point is there'll be certain things which, if we come back to how do people form values, it's by looking and being around what you've grown up with, right? So, for example, you might value money in a different way that Sanj values money, for example, okay? You're right, it's not, and it might not be that they have exactly the same habits and behaviors, but they could. And I think that's the point they're saying. If somebody is, well-bred and carries themselves well and is respectable, more likely that children are that way as well. It's not to say I can't be in other situations, but I think that's the point they're trying to hone in on. But they don't say it the right way. Family have to be good.
Yeah, the family must be fantastic. It's silly, man.
But you will. You'll spend time with Sanjay's parents.
I love spending time with her family, man. We get on really well, and I'm really glad that I've built that relationship with them over time. And it's nice, especially because I'll be in London and I'll be around them more than maybe the guys in Birmingham. But it's cool, and I'm glad I've got that, because if I didn't have that in this instance, it would be a bit more difficult for me. So I guess the family thing kind of does hold true in this little bit of logic.
That's really important. Last year I went on holiday with Shindy's side of the family, and we went to Lanzarote. And so Shindy's sister, she's also married. His name is Pradeep. And so me and him are the brother-in-laws, we're the kind of like outsiders in the family. And it's always an interesting thing, because obviously they're all like, know each other and grown up to each other. And me and him are the outsiders. But I actually like sitting into that role. Everyone seems to listen to you. We seem to be the voices of reason. We seem
because
to be
there's no history there. There's no knowledge of anything. You can just sit there and be like, oh, okay, I can just sit back and observe.
I think this, and I think we should do this. And so it's quite nice. And I think it's very important to have good relationships with in-laws and family going forward. Because although, it's cheesy to say it's the joining of two families, it is if you choose it to be. And you either have that, or in our case, the girl's losing her family and not having the time that she wants to have. Now I know Sanjay's close to her sisters, so you're going to be around her family quite a bit, plus you're moving to London, so I think it's good when you have good relationships.
Massively. Another thing you touched on earlier is the drinking side of things in Punjabi culture. I think that there's like a massive problem with the way alcohol is perceived in Punjabi families, and like you said, the mixing.
Whole new podcast that is.
And like you said, the mixing of the two. I can leave it for another time if you want to talk about it another time.
Yeah, I think it's a really good topic. I think that the taboo, how it's really not really spoken of. But again, I mean, my perspective is, look, I see people when they come in, death's door, yellow's Homer Simpson, because of Sharab. Yellow, like Homer Simpson.
Oh, yellow.
Yeah, yellow, yeah. Because of Sharab. Sharab is alcohol, guys. And look, you can say that there are illegal drugs in the UK.
Yeah.
Alcohol is readily available. It kills more people than a lot of these other drugs. Same with, cigarettes. So yes, it does happen. It happens. And it's the sad thing is it's glorified, isn't it? Like I remember...
Oh, massively so. Of course it's glorified.
I remember somebody, I'm not going to mention name, but in the Bhangra scene, back around the time of Intercom, okay? And I remember where we were somewhere and it was all about, is that how small a peg you're having? Your shot.
Oh, yeah.
That's so small. Like, come on, be a real man. This is the term, isn't it? Be a real man. Have another one. Or come on, you're not going to have another one. It's just people egging each other on. Again, not knowing their own self-worth and feeling they have to prove themselves to people around them. Again, the alpha mentality is wanting to be accepted by the peer group, conforming. It's like, I'll have one. I'll have a peg. I'll have a shot or whatever. It definitely exists, and I've seen it. As somebody who doesn't drink, a lot of my time is just watching this happen and seeing.
Yeah, you must get bored. Like, I rarely drink. I only drink on holidays and stags now, really. I used to drink at uni. But
you can't hack it. I think you should tell everyone the story what happened on my stag.
We're not...
Well, okay, let me give you an option. Either you tell it or I'll tell it.
You tell it better, go on.
Well, my version is going to be more masala, so you tell it, I'll add it in the bits.
So, what happened? Alright, I just got back from travelling. Hang on. I just got back from travelling. Gaurav and Sids came to my house. Me and him got on a taxi. We came to yours, picked up you and Qatar, got on the flight. The flight was at 5 a.m? Something like that?
Something
yeah. So we got on the flight. I think we had a stop off somewhere. And then we got to the final destination, which is Portugal. Yeah?
Yep. Lisbon, yep.
Yeah, it was... we stopped off in Belgium, I think it was, or something.
Brussels or something, yeah.
Brussels or something, right. So we got to Portugal. We did the whole day there normally. Yep. Went out on that same night. Waiting for the other half of the stag to arrive that same night. So everybody's there now. We get home about 4 a.m. Go to sleep. We wake up early the next day because everyone's excited to be around each other. We go out and do stuff, like a whole day's worth of activities.
Yep.
Yeah. We get back. We take a 10-minute nap. That turns into an hour nap, right? Because everyone's shattered. Remember how you burst in the room and Sids was asleep next to me and he looked like his eyes just opened but he couldn't move. Like he was having that weird episode.
See, if you watched Lord of the Rings, I could tell you the reference when Gandalf...
I've seen it.
Okay,
I've seen it.
So yeah.
Qatar sleeps with his eyes open, man. That's scary.
Why is nobody ready?
Yeah, because you burst in and you were annoyed and he didn't expect anyone to burst in, so I'm assuming that he had some kind of half sleep half awakened state. He had sleep paralysis basically, but he could see you and you panicked him to a point where he was like, what's going on? Because you burst in all guns blazing, right? But I was knocked out of sleep because I'm a deep sleeper. But anyway, I digress. So we all get ready. We're not feeling it at all. We're tired. We were walking around on the strip in Portugal trying to find somewhere to go out. Eventually we get in somewhere and I'm thinking I've had like very minimal sleep over the last 2 days. I'm like, it's fine. I'll keep drinking. It'll be fine. I'll keep drinking. But 4 drinks in, I'm standing on the dance floor in the corner. These boys are dancing.
Right. I'll take over now from the start. Listen, you got me to the point. So we guys, listen, if you're listening, we're in this lit club, right?
This guy's making it out to be better than it was. It was some underground club.
Yeah, underground. It was underground. There was dropping some bangers, right? There was some fit girls. Like, this is what you want in the stag, man, okay? This is it, right?
I have no memory of anybody in that club.
Where is Indy, man? Like, where is my videographer gone, right? This is I'm in prime time here, and he's just nowhere to be seen. So now I look in the corner, like right in the corner of this club room, and there's this guy just leaning up against the wall, and he looks like he's diseased and he's not awake. And let me just paint this picture for you. So when Indy came back from traveling, now if you saw Indy now, his man bun is quite well formed. It's in the correct position on his head. Okay. Now when you get off this, go on Google and look up what a man bun looks like. He did not have a man bun back then. He had the technical term in Punjabi is what we call a bibbi jura. Okay, jura is the word for top knot. Bibbi means old lady. He had an old lady top knot, which means it was just so low down, right? And it was like hair was opening, and he was like asleep. And I don't know if he died while he was standing up. I don't know if he vomited. I had no idea. And then I think, then we dragged him back. We're like, yeah, come on, man. Yeah, like 50 Cent in the club, dropping everything. And then...
Yeah, I felt it for like a minute. And then I felt back asleep again.
It. Yeah, but then we didn't see you. Then he left the club. We didn't realise till about half an hour later till we got a text from this guy. He's like, hi guys, I'm in bed now. And I'll see you tomorrow.
I was shattered, man. I needed that sleep. I know myself. I know that I needed that sleep. But yeah, I used to drink a lot at uni, cut down a lot on holidays, and let's get into
that. Why did you drink so much at uni?
I wanted to enjoy the uni life, man. I never drank at school, so I only started drinking at uni. Okay. Right, so I've never done it. So I was like, well, let me just try it, and then eventually it turned into a way of socializing and meeting people when everyone's quite socially awkward, and. If you look around at people when they're drunk, if you're not drunk with them, you struggle a little bit. So you're like, hang on, why are they talking so loudly and I'm quite quiet? Like, there comes a sweet spot at pre-drinks where you're there, people are on a good level. Then when they get past that and you're still sober, you're like, I can't deal with the whole night of this. It's just people shouting and saying they love you and then running off. And it's just like, what? It doesn't make any sense. So I did that for 3 years. But then I slowly noticed my eczema was getting worse and worse. Right. And the dehydration element of it really fucked up my skin. And also you're going to bring this up again, aren't you? I had an IBS episode at my brother's wedding.
What's IBS?
Here we go. Irritable bowel syndrome. The thing that you believe doesn't exist.
What's that?
Amongst doctors. Shut up, man. I'm not getting into this with you. Right.
I think the technical term is psychosomatic.
It's not psychosomatic. You know what, Karan, yeah? If you don't believe me, piss off, innit? Right?
All right. Here's a question for you. Have you ever had a abnormal blood test or camera test or colonoscopy? Because that's shown and proves IBS.
I've had a test where he made me have a tablet and that checked my digestive tract through the colon and then back out the other end.
Okay, what did it show?
It showed nothing.
Yeah, so that's just, I'm just going to leave that there.
Okay,
so
but also, hang on.
You've had no test.
If you saw me at my brother's wedding, you would understand that I was not well. Okay, I was in a bad way. I was so bad. I was about to miss third year of uni. I was so close to saying I'm taking a year out because I was so bad. Right, I couldn't leave the house. I was just here all the time. I needed to be near a toilet. I needed to be near here to try and reset my system. And then from there, I noticed that had an exact effect on alcohol. So if I drank too much, my stomach would play up. So I cut down when I left uni. Did the corporate life. That started to go up a little bit, and then my health started to go down a little bit. So I pulled it back. And now I've just figured out that I don't need to drink to have a good time. I've actually found a group of friends that are okay with me not drinking, and we don't have to go out and drink and have a good time. All of you guys. All the boys from the Bhangra team, even people that I go and meet from uni now, I don't have to drink with them to have a good time. I can just go to dinner, have a nice dinner with them, maybe have one beer and go home, and I'm okay. I don't have to get wasted, and that's been a big lesson that I've learned over time. But when the people around you mature as well, you mature with them. If you mature too quickly and they don't, then you sort of miss out a little bit. So it's kind of like a gradual process.
Welcome to my whole life. Let me ask you a question then. Look, IBS, no bullshit. Yeah, obviously it's a real condition. Stress. How does stress factor into IBS?
So if I'm stressed, I get really bad stomach cramps. I can't go to the loo properly. I struggle to sleep properly, and it all just snowballs a little bit. And then I have to really watch the food I eat. Then I have to be really careful with eating high fiber foods. maybe cutting down on the amount of protein I have, just to try and help everything pass through okay.
Well,
so yeah, it all goes hand in hand with stuff. That's why I eat a really controlled diet. Like anybody that knows me knows that I eat really similar foods all the time because I've found something that works, and I've found a system of food that works. I can verge from it a little bit. So if I go on holiday with you guys, I'm okay. But come the 5th and 6th day, I'm sort of struggling a little bit, and I need to eat normal foods that I tend to eat all the time. That way I can reset my digestive tract and reset my stomach. Otherwise, if I don't, it's a real struggle.
You are meticulous with your food and your food preparation. If you know Indy, the two things he'll have with him always when he comes to meet you is some sort of food in a box and his avian bottle of water, which I don't think he's changed in the last 10 years.
No, I have. I bought matching bottles with Sanj. This blue bottle here.
Oh wow,
that's my thing now.
That's new now. I mean, this avian bottle, you don't... Like, you know when you have to squeeze the bottle, like, he's done that so much that obviously the wrapper's already gone. Like, I don't know if he's done juggo on the bottle. Juggo's like when we jump around and try and break things.
Oh my days.
I don't know what you do to that bottle, but yeah, I respect it, man. You've got it on lock. I remember when we went to... do you remember the Lork's wedding? So that's our friend Qatar's brother. We got Subway for you before the reception.
Oh, that was great, man. That was so worth it. Because I can't eat Indian wedding food. That really messes my stomach up too.
Okay, so what are you going to do in your wedding?
Well, we're not eating at an Indian place, are we? We're eating at like a different venue, like an English venue. So that'd be nice.
Oh, very hoity-toity. All right,
see what I mean? And then on the wedding day, I'll get up in the morning, I'll have normal breakfast, and then I'll just wait until the evening. I can eat a samosa and a spring roll. But it's more so when you have like a chicken tikka or you have something else or you have paneer and you don't know what's in it. And sometimes they put so much stuff in it that's like made on such a mass level. I just can't trust it. Exactly. It can set me off the next day and it's not comfortable. So I might leave it.
What do you do when you go for like mixed grills? What's your sort of...
So normally I'll say to the boys, you boys go ahead. I'm going to eat at home. I'll meet you there. So I normally turn up when everyone's starting to eat. And I'm like, yeah, cool, you boys enjoy. I don't feel bad. Like, I've already eaten at home. Or I'll go and get some food and eat that in the car and then come and meet him.
Okay.
Don't feel bad about it. Like, you've definitely done this before.
I don't feel bad. I mean, I want to laugh more than anything. We're friends, but I'm thinking about, Sanjay signed up to his life. Sanjay signed up to his life of selfless service to you, man.
It's fantastic, bro. It's fantastic.
Food preparation.
It's great. Excellent. She loves it because I give her high nutritious food.
Yeah, that's true.
That's it.
She did tell me, and you told me actually, when you go down to visit, that you stock up the fridge, don't you?
Yes, always. I'll go there and we'll make like a lot of food. We'll go there and make a lot of food, and then I'll. The purpose of me doing it is so I'll take some back to Birmingham. And she'll have some for the next 2 or 3 days after that's already made, so she doesn't feel like she has to cook all the time.
Very good. Look at that, man.
See what I mean? Look at me, man.
That's maturity on a
future husband points right there, man. Big me the fuck up.
Proper jat.
But the whole drinking thing, man, I find it overrated now. I only do it abroad because you have to get bottle service to get into places sometimes. It makes sense. And it's my way of knowing that I'm on holiday a little bit sometimes with people on like a stag do. It just certifies it a little bit more,
That's cool, man. For me, any sort of behaviour is all about what is it you're getting from it, what's the intention. As long as you're doing it because of your free will and choice and it's not based on conformity.
No.
So yeah.
What about for you though? Like, how's it been when people drink around you and you're sober? Like for nights out and stuff. How was that? Were you not bored? Did you not leave early?
Depends where you are, man. I mean, after A-levels, me and my school friends went to Malia. And we were kind of sort of the in-betweeners before the in-betweeners.
Malia, wow.
Yeah, that's where they go in the film as well. We actually went to some of the clubs they went to. And...
Did you follow... Hang on. Did the film come out first or did you go there first?
No. We were there way before.
Oh, okay, I was
just when we watched the film back, we were like, yeah, okay, we went there. It's exactly like that. And we were like, we were 5 Indian guys. The day after we done our A-levels, flying out. Everyone's older than us. We don't know what we're doing. we come from a boys' school, grammar school. We don't know how to talk to girls. We're just like walking around, just like staring at girls, and it's just really awkward. And we just end up dancing with each other. That was it.
Yeah.
It's quite funny. But yeah. So my kind of go-to drink, again, I have a go-to drink when I'm on stags, and it's Red Bull, because it's like, okay, we're going out at night. I'm gonna have to stay up. I'm gonna have to like dance and stuff. And it's just like, man, I need to feel the bull, man. I need to ride the bull. And so my kind of standard concoction normally is one, but sometimes two. Just get the Red Bull in, get wired, and then I'm good, man. I'm good for the night.
But do you not find it difficult to conversate with people when they're drunk? Like to have any sort of meaningful or good conversation?
What typically happens is, whichever group I'm with, there's always going to be someone who's like really drunk who we're all looking after, but they're not all at that level, and so no, generally it's fine. And plus you'll meet people where you go out as well, and you have conversations with them, people you don't know. That's always fun. I like doing that. Yeah, I've been some good stuff.
I guess it's always handy to have a doctor with you on a night out as well. It's like forward thinking, man.
Yeah. I remember going whitewater rafting once in Canada, and the guy's like, "Hey guys, so like just introduce yourselves and like tell us what do you do." And so on our raft we had a fighter pilot, an army guy, me as a doctor, and then I can't remember the other one, maybe it's like a fireman or something. And he was like, "This is a great boat, man. Like, you know, if anything happens, we got it covered." And he was just there's so much bump, and I was just like, "Oh, this is awesome, man." So yeah, I've had one. I think I was on holiday with Shindy, Portugal, and I think a guy had fallen over. It's like an old guy, so he wasn't drunk or anything. He's just fallen over on the street and he's bleeding from his head. And the paramedics were there, so I went to go and help. And there was another doctor actually from the UK, and she was there, and so we started helping. That's probably the only time I've had to do anything like that. I've had a couple of things on the plane, a couple of times. I had somebody fitting once in the Apple store when it used to be inside the bullring.
Oh, wow.
Yeah, so I had that one. So yeah, here's what it is, isn't it?
Oh, it's like you can't get away from it, mate.
It's what I'm born to do, man. Born to serve.
Born to be a doctor.
Well, born to help. Vehicles are many. This podcast, I hope, is helping people. My intention, as I've said before, from Indy and I, is to bring tremendous value to our listeners. To really talk about things that are relatable to a lot of people.
Yeah,
and just to, you know, give you a way of reflecting. So giving you things to reflect on and think about and bring up in conversation and start having more dialogue. Because ultimately, guys, this is the world we live in now is so polarized. It's so that we're not having these conversations and we're so fixed in our mindsets and our opinions that leads to conflict. So have conversations, understand perspectives, and broaden your horizons.
Yeah,
that's the ultimate goal of our conversations.
Of course, I think we've clarified quite a lot with Punjabi, Sikh, and Caste. Have I said that in the right order? Maybe not. Being Punjabi, being Sikh, and being Jat. There you go. Even though I'm not proud to be Jat, but it's fine. It's fine, Karan. I don't go around telling people it anymore. I used to, but I don't anymore, I
promise. Telling someone is one thing, but it's, man, when I see the number plates.
Oh, the number plates, they kill me, bro.
It's like, big Jat, hard Jat, super Jat. And it's just like, you just when you think, you know, like, there possibly can't be another Jat number plate, and people just come out like Mr. Jat. It's just, oh.
And then you've got like spellings of it, J440, and I'm like, that's Jat. I'm like, that's not even saying it the right way, mate. Like, at least if you're spending that much money on it, at least get it saying the right thing. No? Okay, alright. Wow. Number plates, you know what? You're bound to see that at like a Sikh wedding. There's something to look out for at your next Sikh wedding. Try and find a number plate that has some kind of caste thing related to it. There's bound to be one somewhere. It could be on the crappiest car ever, as long as it's the number plate, man. That's what that matters. That's it.
Absolutely, my friend.
Bound to see one on a micro somewhere one day. Anyway, good episode, man. I hope everybody enjoyed that one. Let us know your thoughts. A couple shout outs to go through. So I think the feedback on the last episode, people really enjoyed that one because it was more us conversating and talking in the right way. So we're still working on it, trying to find the way to, you know, break through a podcast and get everybody interactive and talking with it. Any topics anybody wants us to go through, please let us know. We have quite opposing perspectives, as noticed in this podcast. When it comes to politics or whatever, just give us a shout and let us know. Karan, anything to add?
Yeah, I say, look, guys, if there's anything you relate to in this particular podcast, drop us a comment, drop us a review on our Facebook page. Let us know, what bits of culture did you find annoying, that did you not understand growing up? Are you somebody who's had a problem with regards to getting married to your partner and has had to sort of conform to caste? When somebody asks you, what do you identify as, what do you say? Do you say you're British? Do you say Punjabi? Do you say you're Sikh? Do you say you're Indian? What do you say?
I say I'm British.
Let
Punjabi.
us know what you think. Yeah.
What do you say?
Yeah, British, Sikh, Punjabi.
Which one do you say though? I say British Punjabi.
When I say those three, so British, Sikh, Punjabi. That's what I say.
So when you had the boxes,
I see. No, I'm talking about when people.
When
ask
you had the boxes, you'll
Other.
either tick all three or you'll do other and then write in there.
I just write "मैं proper जाता" on other. So on a serious though, guys, yeah. If this stuff has related to you, it will. Okay, some bit of this when you're growing up now, what you've seen. Drop us a comment. We want to get this conversation going. We want to get the dialogue going. Let's talk more.
All right, cool. Talk to you guys soon. Cheers, Karan.